Hi, everybody. Welcome to the third panel in our Incarceration in Nebraska series. I'm happy to introduce our excellent panelists for this panel. Some of us who are still waiting to join us, but should be here any minute. So we have Kasey and Tessa, who work at the Mental Health Association of Nebraska. They're involved in a number of programs directly within Nebraska prisons and people who are released back to the community and dealing with mental health issues. We have Kenna Barnes from Black and Pink, which is an abolitionist organization supporting the LGBTQIA2S plus community, and specifically those living with HIV and AIDS affected by incarceration and the system generally. We've also got Scout Richters who works as legal and policy counsel at the ACLU of Nebraska, where she focuses on women's rights and reproductive issues. She led the ACLU's campaign to end juvenile solitary confinement recently, which led to the passing of LB 230 in 2020, described as one of the most comprehensive bans on juvenile solitary confinement in the country, which was really great for the state. We have hopefully Nature Villegas, a local activist, joining us, who's associated with several groups, including Stand In for Nebraska and the Trust, Respect, Accountability, Community Equality Committee. So she can provide us with some direct experience of being incarcerated herself. Finally, we have Hayden Thomas, who is the former Americans with Disabilities Act coordinator for NDCS, where he worked for the department's Office of Legal Counsel before publicly resigning from the department earlier this year. Hayden's also served in the US Air Force and within the US Department of State's Bureau of Consular Affairs. So as you can tell, absolutely excellent panel, and it will be extremely interesting tonight. We'll start off with each person doing their own talk on their topic, and in between, as well as at the end, we'll have a Q&A and discussion where the panelists can discuss with each other and also take questions from the audience. So without further ado, I'll pass over to Scout Richters, who will speak to us about solitary confinement. Thanks, Scout.
Great. Thank you so much, and thank you for having me. I'm honored to be a panelist. As was mentioned, I've been at the ACLU of Nebraska since 2017 as legal and policy counsel. And when I was prepping for this panel and kind of deciding what experiences to talk about, it really, to me, highlighted one thing, and that is that I feel that every person in the prison system could be part of a vulnerable population, just given the system itself and its origins. And so I just think it's really important to, approach this discussion as we do with all of our work, with a lens of intersectionality, so that we look at all the different factors that would contribute to vulnerability in prison. So whether that be sexual orientation, gender identity, someone's status as being a young person, having a disability, being a woman, being Black, Latinx. I think we can consider all of those things that can really contribute to one's vulnerability within the system. So I just thought that was important to highlight from the beginning. It was kind of what I was thinking about when I was preparing for the panel. And I did want to focus on two kind of big topics with regard to vulnerable populations. So that was, as Ashley mentioned, the youth in juvenile facilities and adult prisons, and then separate topic, well, not necessarily separate, but then women in prison as well. So I just kind of wanted to touch on those two big buckets. And then kind of bringing it back to that intersectionality, I kind of wanted to talk about the intersection of both those topics when we look at the context of the Geneva closure and the effects that situation had on the girls that were subjected to that. So first, jumping into young people in prisons and juvenile detention, specifically relating to solitary confinement. I think just jumping off, it's well established, and piece of evidence after piece of evidence tells us that adolescents' brains are not fully developed The Supreme Court has time and time again recognized that juveniles and young people should be treated differently than adults in the criminal justice system context. We know the harms are well established, long-lasting effects from hallucination, psychosis, depression, risk of suicide. You know, the list goes on, and we know that the risks are just more pronounced for young people. So really beginning in, well, before my time, but definitely throughout my time at the ACLU, I've been involved in this years-long campaign to work to end the overuse of solitary confinement in juvenile facilities specifically. And so it was really incremental changes that we saw throughout the course of years. So it started with open records requests, where we found that some juvenile facilities didn't even keep track of their use of solitary confinement at all. They listed the ones that did keep track, some of the reasons that young people were subjected to solitary confinement were things like too many books in the room, digging in the trash can for cookies, and there was just no standard. It could be days, weeks, months. So that led to a reporting requirement where all the juvenile facilities were then required to submit quarterly reports and about their use of solitary. And then following that was a first attempt by Senator Pansy Brooks to limit solitary rather than just tracking it. And at that first hearing, there were a great contingent of supporters from various fields, but there was the opposition from facility administrators and wardens. And the basic gist of the opposition was, we need this as a tool to keep the facility safe. And it's just something we need. There was a large fiscal note attached to that bill. If folks remember, it was like a $4 million fiscal note attached that a certain facility needed to build a fence in order to implement the provisions of that bill. So that effectively killed the bill. And then after that, we had Senator Vargas have a bill that banned solitary for vulnerable populations, but that was within the adult context, but it did include young people convicted in the adult system, which worked kind of in tandem with Senator Pansy Brooks' second attempt to ban solitary, was LB 230. And there was, again, a very strong hearing, this time no real opposition at all, but it was not prioritized and left on general file, and it was carried over to 2020. And it was important because in the interim, during August of 2019, that's when the reports out of Geneva started surfacing about the horrible conditions, and really came out what the girls were experiencing there. And so we were able to at least use that as a reminder to senators that, hey, you have this bill sitting there on general file. That should be your first order of business in 2020, because it's something that you can pass right away that will actually address something that's going on right now. So that was, well, in my opinion, helped pass that bill in February 2020. And as Ashley noted, it really has been described as one of the most comprehensive pieces of juvenile solitary ban legislation across the country. So it's something that we should really be proud of, but we also know that we need to monitor, because we need to make sure that the law is actually being implemented. So we're going to continue with our open records requests to make sure that that vision is actually being realized, and not just one in name only. So that was one of the major topics I wanted to focus on. And then I did want to move to the topic of women in jails and prisons and touch on that briefly. I don't know if I'm doing on time, but
well, you're fine, you still have 5 minutes, no problem.
okay, great. So just to kind of put it in context, from 1980 to 2016, there has been a 700% increase in the female jail and prison population. So it's the largest growing population. And recently, Nebraska has the horrible distinction of incarcerating the most girls per capita of any state. So very often I feel an overlooked population. We conducted a survey several years ago and sent a survey to all the women who are incarcerated in New York to just get a better understanding of what's going on. Just because in our intake, we primarily hear from men that are incarcerated and don't hear a lot from women incarcerated in New York. So we saw several big themes: a lack of medical care, overcrowding, inadequate mental health care, which 98% of women who are incarcerated have trauma histories and 73% have mental health diagnosis. So that makes it all the more concerning. So we saw those themes, and I think we'll be continuing to do follow-up surveys on that. And then the last thing I wanted to touch on was just a few highlights of reproductive justice issues for those who are incarcerated. One was Senator Kavanaugh recently had a anti-shackling bill passed. I believe it was in 2019, that bans shackling of pregnant people while they're in labor and after giving birth. And then the other thing I did want to highlight, and I know we have Hayden here that maybe he will be talking about this as well, but this spring we had to file an emergency lawsuit to ensure that a woman housed at the York facility could access the abortion care that she was constitutionally entitled to receive and was being prevented from accessing that care. So that's just kind of a small sampling of reproductive issues that we're working on for vulnerable populations. And then finally, I just wanted to kind of bring it back to the intersectionality I mentioned at the beginning. And I think that a great way to illustrate that is with the YRTC Geneva closure and the conditions that the young girls were subjected to, just because it involved youth who are inherently vulnerable, young women are inherently vulnerable, and then disproportionately youth of color who are inherently vulnerable. So all of those things just make this population all the more vulnerable. So just to highlight, the OIG report and the news reports detailed persistent overuse of solitary confinement, no programming, lack of staff, lack of mental health care. And then to top it off, in these horrible, dilapidated conditions with mold and exposed wires, and just very dangerous conditions. So I just wanted to kind of end it on that through the intersectional lens. And thank you again for the opportunity.
Thank you, Scout. That was great. And one thing I'd wanted to say about solitary confinement that I think it's worth people knowing is that there's obviously all the problems associated with being alone essentially for long periods of time. But with Nebraska specifically, because of its overcrowding problem, people in solitary confinement are actually doubled up now. As obviously you know, but I just think it's when you think you can't be shocked any further, I find with Nebraska, there is always something that not even the bad part of solitary confinement is allowed to just be bad. It gets worse. So you are in for 23 hours a day, very often with another person, another personality. And it's really interesting speaking to guys and women, of course, inside at the moment, who say that solitary can be a kind of make or break thing as well, which I thought was really interesting, where when you have the right resources, you can, our co-founder is one of them who had been less than well behaved prior to his stint in solitary, and he really began to educate himself psychology, and he's now qualified paralegal, qualified in psychology, and has just finished his associate's degree in business. And all that stemmed from being allowed to kind of, you know, do what solitary is meant to kind of, and take you away from a population that's not doing you any good, and kind of sort yourself out. So really interesting that even in Nebraska, even that is not the case anymore. So that was just something I wanted to bring up. But that was great about all the intersectionality you brought into that as well. That was great. Thank you so much for that, Scout. And I'm sure there'll be many opportunities. There's so much crossover with the panelists. So we'll get to the discussion at the end and we can go from there. So I'll pass over to Kasey and Tessa from the Mental Health Association of Nebraska, to give us an idea about incarcerated populations dealing with mental illness and how that impacts.
Good evening, everyone. I'm sorry, I don't know exactly what I'm supposed to be talking about. I know it's vulnerable populations, mental health. That's usually the stuff we get asked to talk about. I was talking to Tess yesterday, and I think there's so much to that. Like, you can't talk about it all in the time that we have right now. There are certain points that really stick out to me. One that has become more, I just say in my face lately, is elderly men with sex offender backgrounds who should be able to be released, but need a power of attorney in order for that to happen, and nobody wants to claim them because of their background. So the Mental Health Association is now becoming power of attorney for individuals. That wasn't typically our role, but we certainly don't want humans to die in prison who should have been released, and the only thing that's holding them up is the system. So I think there's a gap there that we need to look at. I think mental health is always a huge, and that goes both ways as far as, men and women admitting that they need mental health because of what happens to them when they do that, because you can end up in solitary confinement or lack of resources. I apologize. I have no voice. I did have COVID and I haven't got my voice back, and I don't know that I ever will. I think I have this new raspy, weird voice permanently now, but I think mental health is a huge issue. I think the stigma, how we traditionally treat it, practices are still from, the 80s, and there's new evidence-based stuff that could definitely be in place. But I think mental health is a huge issue. You talked about the women, especially pregnant women. You talked about lack of medical, but I even think lack of hygiene products and some of their access to just simple basics is also something we need to take a look at. I guess there's just so much there as far as vulnerability and individualizing it. I mean, the amount of trauma and mental health that someone brings in, and if you didn't have it before you got there, you do when you leave. And are we addressing it so that they're not ending right back up in the criminal justice system? I think we need to work harder at access to updated and evidence-based mental health and treatment, rather than just putting them back in our criminal justice system. So Tess, I don't know, that's just some of the thoughts that I've had as we were talking, if you have anything to add.
Yeah, I think some of my thoughts come from more of my personal experience of having mental health struggles. And a lot of times that's what is the beginning of what leads us into addiction and criminal lifestyles and the things that get us incarcerated in the first place. I was very fortunate in the way that even though I have a large mental health history with time spent at our state psychiatric hospital and different therapists and different institutions like that, none of those were related to a criminal background. So when I was incarcerated, they didn't follow me into that criminal background. But what I seen then is that other women that had similar mental health diagnosis, struggles, being put on loads and loads of medications to help them be made manageable, which is not the intent behind medications. And so it just was really kind of eye-opening for me, because I could, like, through conversations, learn that we have some of those similar experiences, similar diagnosis, similar backgrounds, but the difference in how those things were treated or addressed, simply because mine wasn't in my PSI, you know. And so I thought that made a big difference. And then like Kasey was saying, you know, they're well, and Scout too, it's just so broad, you know, when we talk about the vulnerable population, like, it's not just one specific population, it's the incarcerated population is the vulnerable population, you know. And how we look at that. And we like, Nebraska has no programming for reunification. Like, we have some reentry programs, but we don't have anything that addresses women being reunited with their children. We don't, or men being reunited with their children. Like, we don't have that family reunification that creates those strong bonds that we need. And there's proof that they reduce recidivism, but we don't have any focus on those things, you know. We don't have the things in place for people like Kasey was referring to, that are literally stuck in the system because they don't have anybody anymore. Like, that's a reason to keep somebody in prison, because they don't have family, because they don't have connections, because they don't have people, like, you know. And so there's just a lot of gaps in our system. And I do think that we are in some ways making positive change. You know, there's a lot of different programs coming up and a lot of different things happening. You know, like some of the gentlemen that we've trained in intentional peer support have been moved to the youth facility. And I'm hoping that can kind of help with that culture there, and help with some of those things, because like Scout said, like, our youth population is majority minority, like, you know, that it's almost completely made up of minority children. And so they're already coming from, most of the time, a disabled background with lack of resources, lack of those things that some of us take for granted, I think, you know, with just connection and family. And now we've put them in a prison system. We've given them a felony. We've tagged them with the labels that are going to make that future for them even harder. And I know that we're not looking at life sentences for juveniles any longer, but we're putting numbers on them that seem like a life sentence to them, you know. And I think that that's something we need to keep talking about. When you see a 17-year-old boy with a 35 to 50 year sentence, no, he doesn't have a life sentence, but man, it sure feels like it to him. So I don't know how much time we have left, but those were just some of the things that, as Kasey and I talked about it, that came to mind for me also.
Yeah, that's great. Thank you both. What I was interested in possibly is with the crossover. As I was saying, there's so much crossover between the panelists tonight, which is great, about potentially solitary confinement. And I know you guys have the intentional peer support program that supports guys in those roles. And maybe if you just wanted to speak about the advantages that you've seen from that, from having, you know, people on the same level support each other and things.
Yeah, that has, I mean, it's just made a huge impact, because so the fear is talking about what our mental health struggles are. So some of us have that tagged to us with our PSI. We take that in with us. They're looking at that from the minute we hit diagnostic and evaluation center, right? But if you develop some of those struggles, or they become more heightened during your stay, there's a lot of individuals that aren't comfortable talking about those things with staff because of the fear of what the repercussion of that might be, whether that's being placed in a mental health unit, which might feel a lot like solitary confinement at times. You know, they don't have the same access to programs or the yard or the rest of the population. And so a lot of individuals that do begin struggle are not wanting to talk about that because they don't know what will happen if they do. They don't want to be put on medications that numbs out all of their feelings. They just want to figure out how to work through these feelings, you know? And so through intentional peer support, we've been able to provide another outlet for that, where they can come and talk about some of those thoughts and those feelings without fear of those repercussions. If I'm having thoughts of self-harm or suicide, I have a safe place where I can talk through that. And in my experience, having that safe place to talk through that is what gets me to a safe place for myself, you know? And so we're able to provide those outlets without fear of that repercussions. And I've been really, really surprised to see how much support we've had through that, through the DOC, even just supporting us when we said this needs to be confidential. We need to provide this space for them, and then being able to be given that. Yeah, and it's just a lot of things, you know. It can come from just looking for that support and growing as an individual, because that's what peer support is about. It's about developing relationships where we can create a safe space for us to feel comfortable taking risks, and we can learn and grow from each other. And so it's not just the individuals that we've trained that are growing, or the people that they're meeting with that are growing, but everybody is allowed to grow together. And if we can learn how to do relationships differently in intentional peer support, which is what our whole training is based on, then they can then take that skill set and show the rest of the community how to do those relationships differently through their interactions as well. And then it's like, you know, the hope is that ripple effect. We just threw the rock in the pond, and you know, we can watch that spread, and eventually what would be like a big goal, big dream, is to see those silos of the us versus them be broken down, so that we can all just see each other as human, because that's what's going to benefit the population that's still incarcerated, as well as our community, because most of those individuals that are incarcerated will be a part of your community. And Kasey, do you have anything else you want to add to that?
Nope, I think Tessa and I work in a lot in the same areas, so we talk the same language, and that's, I mean, that's what we're doing, and that's what we're going to keep trying to do, and expand those programs and find the gaps where people aren't getting what they need, and try to fill those, so that again, people are being able to for sure get their basic needs met, but then actually be able to come out into the community prepared for that.
Great, thank you both. Yeah, that's an excellent point about what incarcerated individuals take out afterwards, not just in skills, which is talked about a lot, but in coping mechanisms and ways that they build relationships. So that's excellent. Thank you both very much. We're a little bit ahead of time, which is unusual for me. So I'll pass to Kenna Barnes from Black and Pink to give us an overview on her topic.
Hey everyone, I am Kenna Barnes. I use she, they pronouns, and I work for Black and Pink, which is a prison abolitionist organization. We're a nationwide organization, but we are honored to have our headquarters in Omaha, Nebraska. We see that Nebraska is often overlooked with a lot of our policies, and specifically around trans and queer folks and people who are within the confines of the prison industrial complex. So I don't have many Nebraska specific things to say to you all about trans and queer folks who are living in incarcerated, or who are system impacted. But I mean, it really just kind of generalizes to everyone. A huge piece of what we do is working with folks who have multiple oppressed identities. So everything that everyone is saying, you know, we have trans and queer folks who are living in oppression. We have Black and Indigenous folks, people of color who are living in oppressive spaces. We have folks who have disabilities and have HIV and have, you know, a multitude of other identities that absolutely impact the way that they interact with the justice system. Queer and trans people have historically been criminalized for being queer and trans. In a lot of places, those laws are still in existence. Sodomy laws are against trans and queer folks. So, you know, working through what that looks like to show up for our trans and queer siblings is really nuanced, and it's really an interesting space, and a lot of people have a lot of feelings about it, and that's fine. That's great. You should have feelings about it. But a few of the things I want to talk about tonight are specifically, so sex work is a huge issue within the trans and queer population around incarceration. And we hear a lot of things about human trafficking, specifically in Nebraska. And those are all legitimate concerns within our population. However, it's hard for me when we see that, you know, it's 120% more likely for young people who are LGBTQ plus to be homeless. So how are they supposed to survive? How are they supposed to get their needs met? When we see multiple, for like so many people who are unable to have jobs or who are unable to, you know, get healthcare and housing, and who identify as LGBTQ plus, you know, people often call sex work survival sex work. We all do jobs to survive every day. That's just the reality of the situation. And this job is just maybe a little less formal than other jobs, but it gets your bills paid and it gets your meals, you know, you get to eat. So I think it's something that we have to acknowledge and really reckon with. Like, if we want to reduce sex trafficking, we need to look at what sex trafficking even is. I think a lot of folks don't even understand what sex trafficking is and categorize people trading sex for money as sex trafficking, when in reality, that's just capitalism at its finest. And I know that, you know, there's a lot of targeting that happens with immigrant communities around sex trafficking or sex work in general. And there's a lot of targeting that happens with Black trans women with sex work and soliciting sex work specifically. So when you're criminalized for something that you have to do in order to eat, you're going to have higher rates of criminalization. Another one that people have a really hard time with is the sex offense registry. And that's a huge issue for specifically gay men. And we see that there are much higher rates of gay men who have sex offense registries backgrounds. And once again, being trans and queer used to be literally illegal, and in some places still is. So getting put on the sex offense registry is something that is a way to criminalize LGBTQ plus folks. Another really tough space is that in Nebraska, but in a lot of other places, we criminalize the transmission of HIV. So when folks are positive with HIV and they are aware that they're positive and they transmit it to a partner, they are criminalized, which is, again, another really gray area. What does knowing that you have HIV look like? What does having the resources to protect yourself look like? A lot of prisons don't even provide condoms. So how, especially when folks are incarcerated, like how are we supposed to make sure we're getting taken care of? Trans folks are also highly criminalized in our justice system. It's 1 out of 6 trans people have been incarcerated, and then half of all Black trans women have been incarcerated. Those are huge numbers. That's huge. So really working through these identities and like what that looks like when we show up in spaces and then how we're perceived is a large piece of this conversation that I think will never end. And I always say, if you think what people are doing outside of prisons is bad, wait until you hear what the officers and the police officers are doing inside of prisons. It's really disturbing. They're denying access to medical treatment for people. They're denying hormonal treatment, which is terrible for people's mental health. They're denying HIV treatment, which, I mean, that's just like for people to survive. And, you know, the queer and trans community has really high rates of solitary confinement because of this idea that they have to protect them, right? Like they have to like keep them away from the general population so they're not assaulted. Solitary confinement is not a protective factor. And oftentimes folks are put into dangerous situations on purpose by the correctional officers. It's, you know, there's a lot happening. And I think that's like this whole entire panel is going to be that. And this is heavy and this is hard. And in Nebraska, we have, so there's a organization that rates your sexual orientation and gender identity like policy within your state. And we have a 4 out of 38.5. So we are like super failing. There's no non-discrimination clauses for a lot of things. Sioux City has protection on housing. Omaha has protection on housing and various other things, but that's pretty much it. It's pretty dismal in Nebraska, but it's also dismal in other spaces. Like this is a very patterned situation. And I also want to say that queer and trans people are very resilient and are continuing to show up and show out and do this work. And I think so many of us, you know, people want to create programming and they want to make sure and they want to throw all this money at people with these foundations. And Black trans women specifically have often been running these programs far before anyone else was thinking of them. So if you're somebody who has a lot of money and you want to give it to people, give it to the people who are doing the work. Don't create your own program. There are plenty of people that we would love to support with your money if you have it. Like everyone on this panel would love your donations because we're doing the work. It's us who are showing up and showing out every day. And we love the support and the money and all the good things, but you know, it's really important to remember that these communities are already taking care of themselves. We just have to support them even more than what we already are, and really, you know, keep our nose to the ground and say like, hey, maybe there's a reason why these groups are continuously showing up at higher rates in jails and in prisons. Yes, thank you so much for letting me be here. I don't know if you have any questions for me at this time, Ashley, but of course I'm ready for the end as well.
Sure, thank you so much. No, that was extremely interesting and just aspects that you often don't think of if you're not directly involved in that community. So really interesting aspect to that, and the comparisons between work is work, and you know, you have to do what you have to do, especially in it's a pure survival place, prison, as we all can appreciate. So no, that was really interesting. Thank you. And we'll pick up, as I said, so much crossover. So we'll get to the discussion at the end and we'll pull in everyone then. Thank you so much, Kenna. So finally, well, not finally, sorry, 2 more panelists to go. Hayden Thomas is up next. So as Scout discussed, Hayden was the employee that publicly resigned from NDCS, which some of you might have picked up on. So he's got lots of kind of crossover subjects, his main one being disability, as he was the coordinator for NDCS, and then we can pick up on other subjects as well. Thanks, Hayden.
All right, there we go. Now I'm unmuted. Thank you for that introduction. So yeah, as she mentioned, I actually have the experience of having previously worked for the department as the ADA coordinator in the department's legal office. So hopefully some of the insight that I can offer will be helpful and beneficial to this discussion. So when it comes to disabilities in prison, obviously, persons who are disabled inside of prison and outside of prison are more vulnerable than the regular population would be. So the good news is that we have laws that are designed to promote equality and equity, and to make sure that disabled persons can live their life in dignity, and they can live their life as normally as possible. The bad news is, in the prison environment, these laws and persons with disabilities aren't always prioritized to the extent that they should be. So this slide will let you know that one of the big challenges with the disabled populations who are incarcerated is we don't have a lot of solid data at any level, whether it be federal, state, or local, that can tell us anything really meaningful about persons who are incarcerated that have disabilities. The most relevant data is a 2012 study by the U.S. Bureau for Justice Statistics. As you guys can read up there, but an estimated 32% of prisoners and then another 40% of jail inmates reported having at least one disability. So we're looking at 1/3 to possibly upwards of almost 50% of the inmate population, whether it be in prisons or in jails, have some disability. So that in itself is somewhat troubling. And that demands action on behalf of the administrators who run our state prisons and our local jail facilities to make sure these people are taken care of. I think potentially more troubling on my end when I was in the role as the ADA coordinator was that more persons of color in state prisons are more likely to have disabilities. And I'm sure, as most of you know, Nebraska has an overrepresentation of persons of color in our state prisons compared to their number in the population. And just overall, prisons are more likely to have persons with multiple disabilities than your jails or local correctional facilities are. So that's one of the first big challenges, is making sure that we have actual meaningful data that we can use to develop policies to ensure that we're providing the programs and the services needed to help people live and manage their disabilities while they're incarcerated. On a positive note, during my time at NDCS, I do think we made steps in the right direction. However, looking at things from a bigger picture, those steps were insufficient to meet the challenges that the disabled population faces. So that's still, more work to be done. You can go ahead and hit the next slide. But so anyways, here are some example conditions that could constitute a disability. And this list is very broad. The definition of what constitutes a disability under federal law is also very broad. And in my experience, just about every person that I ran into while I was in the various facilities seemed to have at least one condition that could constitute a disability. You can go ahead and hit the next slide. And so I just briefly noted, when it comes to the corrections environment, the Americans with Disabilities Act, which is the federal civil rights law, that mandates that state and local governments provide services to ensure people with disabilities can participate in any program or service in a prison. It applies to essentially every part of the prison, whether it be intake, classification, housing assignments. You can hit the next slide. Mental health services, medical care, dental care, recreation. You can hit the next slide. Community corrections, good time credit, work release. So really anything that the prisons offer as a service or a benefit to the persons who are incarcerated, they have to be accessible and equal to persons regardless of their disability. Now, in a perfect world, that would happen every time, and we would always have something in place to accommodate every single person who has a disability. But unfortunately, that's not the case. And like I said, while I think we took steps that were in the right direction during my time at NDCS, overall, there's still a lot of work that needs to be done. So one of the first challenges for persons who are incarcerated, as far as living with and managing their disabilities while also engaging in the rehabilitation that they need to re-enter society, one of the big challenges is the overcrowding situation, and then also resources. So just from the data that NDCS has out publicly, right now the prisons are operating at 146% over design capacity, and they're operating at 116% over their actual operational capacity. So that means that there are less resources available, whether they be programming resources, medical resources, or educational services to help these people manage their disabilities and get the treatment that they need. A good example is at the Lincoln Correctional Center, which is currently operating at 168% above its design capacity and 135% over its operational capacity, according to NDCS's data. The Lincoln Correctional Center is the center where we call it the secure mental health facility is. That's the facility that has the most invasive or the most in-depth mental health services for the people who really need it. So this is where people who require the most attention and the most mental health resources and services would go. However, the Lincoln Correctional Center is a very old building. It predates the adoption and the passing of the ADA. So none of that prison is really outfitted or accommodating to persons who have mobility impairments. So if you use a walker, if you're in a wheelchair, if you have some kind of mobility impairment that would prevent you from traversing stairs, those services are essentially cut off to you, because that's the only place where NDCS offers those very, very intensive mental health services. So not only is that technically a violation of federal law, but it's also just a problem that we should all care about, because it just goes back to, are we putting persons in prison to rehabilitate them? And if so, we have to do everything possible to make sure that they actually have the resources available to them. Another good example is at the Nebraska State Penitentiary. I myself am a veteran, so I loved going down to the Veterans Housing Unit at the Nebraska State Penitentiary and visiting some of the incarcerated veterans there and talking with them. It's one of the best housing units, I think, in the entire department. Unfortunately, to get down to it, you have to go down a flight of stairs. So again, if you're a veteran who has a mobility impairment, or if you're in a wheelchair, that service is completely out of the question for you. And so that's very unfortunate. So resources are a big challenge. Resources are a challenge, as well as also just getting the information to people who are incarcerated and letting them know what your rights are under the ADA and what services are available to you or could be available to you. Another thing that's a big challenge, and I think Scout kind of touched on this, is the use of solitary confinement. The department calls it restrictive housing. A lot of times with disabilities are cognitive or they're mental. And a lot of times for people who have, mental impairments or cognitive disabilities, kind of like the symptoms of their disability manifests in behavior that doesn't necessarily comport with the rules or the standards that are expected out of persons who are incarcerated. Maybe someone loses their temper, or maybe someone's going through a a mental breakdown or a crisis, and we need some kind of intervention. It's normally what happens when behavior becomes erratic, even if it's the result of a mental impairment. They would be placed in restrictive housing, solitary confinement, whichever you prefer to call it. And at the end of the day, we're treating the symptom. We're treating the symptom of their disability, but we're not actually treating the underlying disability itself. And that's problematic because we're essentially punishing them for having a disability. And so that was another challenge that I tried to work on, was making sure that we weren't punishing the symptoms of disabilities, but we were actually providing treatment to treat the underlying conditions. So I will say another challenge to persons who have disabilities, and this has kind of already been touched on, but I can say this just from my experience. Sometimes I do think there is a degree of bad faith decision-making within the organization. And that can also present a challenge. As some previous presenters have noted, everyone who comprises the incarcerated population to some extent is vulnerable. And I do think there were some people who didn't always make decisions with the best faith or the best intent. And just that example, as it's already kind of been alluded to, I resigned from NDCS because I worked in the legal department. We had an issue come up where a woman who was incarcerated wanted to exercise her constitutional right to seek abortive healthcare services. And so the department went to their attorneys. Just full disclosure, I'm not an attorney. And full disclosure as well, Ms. Scout Richters is the attorney who represented that inmate in this case. But they went to their legal office and asked them, hey, research this, get us an answer. They did it. They researched it, and they came to the conclusion that it was clearly established within American jurisprudence that persons who are incarcerated are absolutely entitled to still access abortive healthcare services. The department basically said, no, too bad. We don't like that answer. We have another preference and we're going with it. Find a way to justify it. We know it's wrong, but we're going to press forward because it's politically expedient for us. And so, that's just an example of bad faith decision making. So with that in mind, right, what can you do as whether you're an activist or you're interested in this kind of stuff? Obviously, if you guys have an interest in the prison policy within Nebraska, you can always write your senator. You can also, if you have interest in a specific area of prison operations, or if there's something you want to get a better understanding of how the department's doing it, you can also submit a request to the department to access their public records. And then as well, occasionally the department has to develop new rules and regulations. And some of the rules and regulations that the department develops are done through what's called a notice and comment rulemaking process, where the department will publish, they'll publicly outline, hey, here's a new policy that we're going to adopt. We're going to take public comment on it for 30 days. And you could go through and offer your comments on the policy and have your voice heard that way. But so there's a lot you guys can do to be involved. And that's why groups like Nebraska's for Prison Reform and the ACLU and all these groups up here are so important. It's important for external sources to also have some oversight into what's going on into our prison system and to government as a whole. So with that in mind, I just do want to end on a positive note. I do want to say that by happenstance, I did have a chance to actually meet the person who replaced me. And my replacement, I feel, is a very capable individual who has the best intentions at heart. And I hope that they continue the very important work that I had tried to continue at NDCS. So thank you guys for letting me speak, and I'll be happy to take questions later on.
Thank you so much, Hayden. That was so interesting. As I said, we're actually doing very well for time. And as Hayden said, we will pick up with the questions at the very end, which I see one has come in for you specifically. So we'll go to that as soon as we get to the end. So finally, for real this time, I'd like to introduce Nature Villegas, who, as I mentioned at the beginning, is associated with a number of groups in Nebraska and who has experience of being incarcerated as well. So if she could take the floor, that would be great. Thanks, Nature.
Thank you. Hi, everyone. It's great to share space. Excellent speakers, so no pressure, right? You know, I originally came here tonight to share a little portion of my story, and sitting here listening to different people speak, I realized how much more of my story actually fits here tonight. It's really nothing to brag about, but it does fit, and I think it's mandatory that a story be involved to kind of put things in perspective. So I was taken from my mom at 9 and went through acculturation, and that was my introduction to the justice system. I was that juvenile that was talked about on this panel. I was also the adult. 10 years ago, I was arrested and sat in Hall County Jail for 6 months before I ever spoke to a lawyer. During that time, I found out I was pregnant, and I apologize, my voice is trembling, but the people in my story are no longer here and told me one day I would share this story. So here I am. When I found out I was pregnant, I get what's called hyperemesis, and you literally dehydrate to death. I'm not trying to be nasty, but I don't know how else to explain it. I'm not a doctor, but you will literally throw up to death and you dehydrate. And so I let them know immediately, like, hey, I have a medical condition that happens when I'm pregnant, and I need to get on this, or you're going to have a serious problem on your hands. And I just knew, because it had something to do with a baby, that it would be fine. And during those 6 months, I was not fine. I was given Tylenol and ibuprofen to use every 4 hours I was to trade. During the 6 months, I was vomiting nonstop. And the thing about this condition is, it doesn't matter if you eat or not, you're going to throw up. It was very hard on my body, and it tore my throat up because we don't have the right supplies in there to clean ourselves, let alone take care of our dental and things of that nature. So my throat was very raw, and I wasn't able to see a doctor through these 6 months. Only medical practitioners on site at Hall County Jail. You're never allowed to leave there once you get in there. No bullshit. Unless you're being taken to prison or released. So I thought that was a joke. That is not. So within this 6 months, and as my body's deteriorating, I'm steady putting medical kites in that I need to be seen. And there's a certain process you go through in order to, work your way up to a real doctor before you can even get past these nurses. So by the time I get to this doctor, I had lost about 25 pounds. Well, my first visit, from my check-in date to about 2 months later, I had lost 25 pounds. So I get to the doctor and I tell him what's going on. And I'm like, I really think I should get to a beta. I need to see an OB. And I was told one would be brought in. I was given a special diet, and a medical diet at that. So these are things that are supposed to be strictly followed, obviously, for obvious reasons. I'm also hypoglycemic. So I found that I could eat Jell-O because it was so cold, it was soothing on my throat. So literally I get this doctor to okay that my meal gets to be Jell-O. At this point, I'm so grateful to be able to put something in my body. It was like celebration. So I'm happy with my Jell-O, right? We're 4 months in now. Baby's growing, I feel baby moving and stuff. And one day my Jell-O isn't on this tray. I said, excuse me, ma'am, my Jell-O's not here, you know, and I just thought she'll call and go have them bring it down like they would any other thing, right? When they forget the little coffee and stuff. She ignores me. Well, obviously you didn't get your Jell-O today. And I said, ma'am, I don't think you understand, like that's literally all I can handle, and it's all I get, and I'm pregnant and everything, like. And she just looked me up and down, went on about her business. Then she brings me this little cup, and I don't know if anyone on the panel's been to jail, but they're about 2 inches tall. And I don't know if I have any soup makers in here, but if you get the boiling cubes, you know what happens when you put that into water? It's grease. And it's nothing but salt seasonings. So in this 2-inch cup, I've got a whole cube, or who knows how many, but it was melted in 2 inches of water. And that's what I was given. That was my soup, because I'm sick. And I said, I can't drink this. It's gonna burn my throat. And I got so mad, standing in front of this woman, like deteriorating with a life inside me. And I got so upset that my patient cried to just be human with me and get my damn Jell-O so I could go back to my cell and not bother you. But I got upset, and I thought, you know what? I'm gonna have to make a little noise if I'm gonna live through this, because I'm gonna die in here. I knew that day I'm gonna die in here if I don't make some noise. And maybe if I make a little noise, somebody else in here that keeps saying, damn, that's messed up, is gonna have just enough courage for the day I don't have the strength to do this to be my voice. So I threw that shit all over the floor. And I said, you drank that stuff after you've puked for 5 months straight. Then we'll talk about it. Please open my cell. She had the guards open my cell. I went in my cell. They locked me in. The sergeants came after someone mopped the floor so generously, but she did not have Dawn soap or whatever fights the grease. And she literally made a grease skate rink in G Unit at Hall County. So the sergeants come in, and guess what happened to the sergeants? Yeah, they slid all the way across G Unit, coming to check me about my little antics, right? About my little yeah. So needless to say, I'm now in SEG, which is the handicap cell, because I'm sick. I was sick. So I get thrown in a handicap cell. I was left there for the remainder of the time I was there. There was a young guard that started. I would give her name, but I don't know if I should. She started, she was young, she was ambitious. She said, hey, she would always come by my cell, talk to me. That's how I knew what day it was during being shut down like that. That's how I would determine what day of the week it was, so I could keep track. And she said, I'm going to be back in a week. I'm going on vacation. And within that week, I had lost 40 pounds. And I didn't move in that cell because I was dying. And I knew I was dying. And when she came back, she came to my cell and she rushed in when I didn't respond. And I said, you know, I just need to get to the hospital because I don't think I have much more left for this baby. And I haven't felt the baby move at that time for like 2 months. And I was in solitary confinement at the time, so I wasn't allowed to go see a doctor because of my antics. I was considered a violent offender, but I was already a violent offender on my charge because I was a fighter. So this guard got it approved and said, no, this girl's gonna die on our hands, you know, and basically pushed through for me to get to the hospital. And by the time I get there, the doctor slid this guard a card and said, if she's ever able to sue Hall County, I will testify for her because I have no clue how she's even alive, how her kidneys are functioning, or how the baby's even alive. And that's when I learned that my baby was still alive. And So to make a long story short, I do end up in York. My baby is alive. I bugged that warden every day of my county stay and every 30 days of my D&E existence to plead for just one chance. Because I knew on black and white, it did not look like I should get this chance, but I knew we lived through this for a reason. And I begged that warden to just give me a chance to pave a way for other women like me, because I just knew there was going to be other women like me and that there were women before me that maybe they didn't make it or the baby didn't make it. So I felt like I had a responsibility, not only for myself and my children, but for the next ones to have to go through this, because no one's on your side in there. Whether you're dying, it doesn't matter. They don't care. They don't care. And the warden let me through to the nursery, and my baby is 10 years old now. She'll be 11 in December. And 10 years later, you know, even through that process, I went through another incident with Adams County where I was given a kidnapping charge when I came out on a furlough. I was the first woman to furlough from York Penitentiary. They wanted to start with the moms and try it out, and I was the first mom to do that. And I was knocking barriers down. I'm an orphan, so I didn't have a team, you know, out here. It was me and my kids. And I said, hey, you know, how am I going to get to work? How am I going to get to meetings and all these visits and things, you know, when I have kids? And so my PO knew I was really on my stuff, and I had a lot of support from the nursery. They knew I meant what I said to that warden. I know that I wasn't the same person, and I know that survival made me a different person than what living is, because I'm living today and I'm a whole different person when my soil's right. But I was given a kidnapping charge and told, well, don't you have a parole hearing in 2 weeks? We'll make all this go away. And I said, no, I'm gonna have to go to my parole hearing in khakis. I'm not signing on that paper they slid me. If I signed it to make it go away, was custody of my children. This is what our state is doing. I lived through this. This isn't made up. Telling you this story, I'm trembling right now. I don't know if I'll have repercussions, but damn it, this happened. I lived through it. And I'm so grateful to be where I'm at today, because I don't have to be here today. I don't have to have been given that chance. I work somewhere where I can have this as my life and share it and help people and teach people, open people's eyes. Yes, it's terrible, but if sharing the story makes the change that has to come, whether it be an individual or collectively worldwide, I'm with it. I'll share this story. I'll take the repercussions, because it's not a repercussion if it's bringing the change we need. Because I'm telling you, I have no idea how I lived through that. I have no idea how people live through solitary confinement for decades at a time. That was 7 months of my life that felt like an eternity that I'm still affected by today. This happened, and I'm not the only one it's happened to. And I hope us sharing and being in these spaces to have these uncomfortable conversations make others more welcome to come and share whatever story it is. Because that life experience is part of the equation that I don't care how many ABCs we have behind our name, I have them too. Guess what? None of that matters compared to my life experience. I promise you that. And I'll stop on that note because I feel like I've taken the whole time. Thank you for sharing space.
No, thank you, Nature. That was amazing. And I think nothing could have showed more clearly why we always ensure there's former incarcerated voices in everything we do. Our board is 50% currently incarcerated, with formerly and no incarceration as well on the rest of the board. But that was just an excellent showing of why it's so important when we talk about all subjects that we help with from the outside of people that have been involved in it. There's just no comparison to that whatsoever. So thank you so much for that. And I know it can't have been easy to share, but I do think, as you say, it's so helpful for people to hear that. So we'll pick up on that and other things in the Q&A / discussion. If you, Jason, want to kind of take over that, I know we've got a few questions, so just go from there if that's okay.
I'm just gonna start with you. Nature, are you ready to be? Maybe I shouldn't start with you. Are you? I just felt like right after the end of your story, somebody asked, what can an average citizen with no history in the system do to support?
Well, I think you started by showing up here tonight, right? We all start somewhere. You know that the best advice I give people is not to get caught up in the, well, what if, just whatever your heart is moved to do it. If you don't know what direction, if you have, you know what I mean? Like, we always think we're not doing enough, and every little step counts. You being here tonight, that alone, I mean, I've got a pocket full, I've got papers, endless notes from everyone talking. So I think you started in the right direction by showing up here tonight. Show up.
And I'm gonna pluck a few out of the chat. So I'm gonna direct this one to Tessa. Where is it at? So Samuel had asked, how do we do this? And you were speaking about family reunification. So he's asking about uniting families and kind of getting a context of how do you feel we would do this?
So I think there's a lot of things that can be done. One of the biggest barriers, I think, with family, even just staying connected, is the location of our prison. So our women's prison is out in York, Nebraska. We've got a prison in Tecumseh. The rural areas, a lot of these people, the individuals that are incarcerated, are sometimes they lack the resources to be able to get there, or maybe they need to work, or they, and so there's, or if there's children that are involved and they don't have the family support to help them get back and forth. And so a big part of it is having resources. I've done some research on family reunification programs that are happening in other states, and that was one of the biggest pieces that they looked at, was finding the financial resource to buy a bus and do transportation, and providing family visitations that weren't so confined, where you have to be afraid of your child hugging you too long, or and all of those things. And so, I know for me, for example, my incarceration wasn't very long, and my children didn't, like, I was there for a little over a year to a year and a half. My children actually never came there and saw me. And I really went back and forth, was like, was that better for them or was that worse for them? Because they didn't have to see the fences and the barbed wire and the pat searches and all of those things, but they also went that time without having that physical contact with me. And so I just think that there are a lot of different things that we can do. Beginning with writing a curriculum that talks about that reunification process, and accepting that, like, one of the biggest learning curves for me is that all of my children were very different. Like, the process that I went through for that reunification was not the same. I have 5 children, and it was so different for every single one of them, and accepting the way that they might deal with my incarceration is going to vary from child to child, as well as, just with your family in general, from parent to parent, from all of those connections and those healthy support systems that we have out here. The damage that we do, whether that's during our crime, our addiction, or that lifestyle, it's, it damages relationships. And so really looking at how can we provide safe spaces to rebuild those relationships, look at what those different things might look like. I don't generally, and so I don't generally go to a clinical model, but I do think that there are some parts of this that would be very helpful in, is to have that clinical piece with some of the therapy and things that are needed for that reunification with children and family. Yeah, unfortunately, our state does not have a program written or directed towards that at all. And so that it just makes that reunification process that much harder. I was like, one of the things that I look at was just even the discouragement of what it takes to get your children back out of the DHHS system, and some of those hard hurdles that we have ahead of us, and that discouragement can push us right back to the lifestyle that got us incarcerated in the first place.
So, yep, I hear a gap MHA could look into filling as that.
Kasey and I have been talking about it for a few years. We will all wear a lot of different hats, so it's just a matter of finding time to write a curriculum. So if you got anybody who's willing to help us with that, send them my way.
So since this was already in the chat, Hayden, and you might have already read it, how do we get good data regarding, for instance, those who are intellectually, developmentally disabled, who are incarcerated, if they don't keep adequate numbers in the first place of those who are I/DD? I mean, intellectually and developmentally disabled. That's for, they was asking you particular, Hayden. And it's in the chat if you want to reread it if I read it poorly.
No, I got it. I was just waiting to be unmuted. Yeah, so the question is, how do you collect that vast amount of data? Well, there's really a two-step process, and it's pretty simple. First, you have to actually collect that data from the people who come into your facilities. But second, you have to have an infrastructure to store it, and an infrastructure to be able to actually store it and to employ it and use it in your decision-making processes. So one of the things that I worked on while I was there, we had worked with the state's office, their information office. There's a separate office that works for the state that controls all the IT things. And we actually began the framework to implement a tracking system into the NICAMS system. That's what the Nebraska Inmate Case Management System. So it's eventually going to be integrated into NICAMS, where whenever a new person comes into the custody of the department, they'll fill out a survey and they'll note like, hey, what are your disabilities? What special accommodations or what special needs do you have to manage your disability? And then that'll go into NICAMS, and then their case managers, the staff that interact with them will be able to see that, be able to pull that up. And then ideally, like in a perfect world, eventually it'll get to a point where we can just aggregate all that data, and we could, I would like to be able to click on NSP and, get like a pivot table of like how many persons with intellectual disabilities do we have? How many persons with disabilities do we have? That way it really paints a picture and gives us useful data that we can employ. But that's still hopefully in the process. But the second thing is you just have to collect it. I mean, what it came down to is we were just going to have to go person by person for all the people that are currently incarcerated, all over 5,000 of them. And we were going to have them complete this survey, and then we were going to have to input the data. And that, a lot of people thought that was, well, that's going to take too long. That's too arduous. But at the end of the day, I mean, I think it's worth doing. So hopefully it still happens.
A perfect world. Speaking of a perfect world, I'm gonna go Kenna. Is that your name? Can I pronounce it right? Kenna. Somebody, you said about prison abolition, and somebody wants to know what's that look like. I figure that might be closer to the perfect world.
Yeah, I think that's a really great question. And I think that's the thing that we're all asking all the time. Miriam Kaba says that, yeah, we might not know what that looks like, but nobody's letting us try. So I think that it's really important to have all your feelings and thoughts around abolition. But in reality, communities take care of themselves better than the state ever could and ever has. The state is killing us. That's just the reality. So when we can maneuver into places where we take care of ourselves, that's abolition. When we're showing up on a panel together and we're saying, how do we support each other? That's abolition. This is what abolition looks like. I think it's a really big concept, and I think it's really hard to navigate and to figure it out. But once again, if nobody's letting us do it, how do we know?
So I'm here, a community taking care of itself as opposed to a system.
Yep, absolutely.
Thank you. That's the best explanation I've heard so far, because it's a difficult thing when they put hundreds of years of effort in thinking we only can live in this one system. Kasey, So you spoke about power of attorney. Again, somebody was like, what where you have people in the gaps, for instance, the elderly sex offenders who have nobody, and they fall into that gap of, we're not going to release them even though they should be released because they have nobody. So somebody kind of wanted to know how that works with the organization and what that looks like and how that all works.
I don't exactly know, because this is the first time I've been asked to do this, and I certainly decided to look into it because MHA isn't going to be about having someone who could parole, but because of a system hang up, is not able to do that. So I'm learning more about it, but I do know that Nebraska lacks resources for people, vulnerable populations of all the people that we just talked about, who need good, healthy, trustworthy people who won't take advantage of them, to be power of attorneys for them. And it's really difficult to find. I think we need to have a really strict process in place, because they are vulnerable and people take advantage of them. I see it all the time. We've seen it in the news with mental health especially, but I do think it's something that's needed. We get asked to be power of attorney all the time, and I've done it 3 times now. I'm very skeptical about doing it because I need to know people to do that for them, and to know what their wishes are, and to know, there's a lot more to that. So I think that's something. We need a place where people can request, kind of like a CASA volunteer for a youth, or where somebody who needs a power of attorney, where these people have been screened and there's a pool of people who are interested in doing that. I think that would be really helpful. I also wanted to touch a little bit, if it's okay, on Hayden's comment about identifying the populations and being able to track how many people with developmental disabilities. I think we need to be looking at traumatic brain injuries, mental health, all those types of things. And in order to do that, even being properly assessed and coming into D&E, they're doing some of it, but there's a whole lot more that I think we need to be, like traumatic brain injury. That's been a big one lately. And I think we need proper tools that assess these things for folks, and being able to get them the supports with the current data, evidence-based practice programming that's up to date, that will support these individuals.
So Scout, howdy. Me and Scout go way back, only like 4 or 5 years, but still for me, it feels like way back. So this is a question, and I hear this a lot because I interned with ACLU, and I have connections with ACLU, and I'm very proud of them connections. I'm actually pretty proud of, there's almost no connection I've had in the past 4 years I'm not proud of. With that being said, so this is not, so I'm just gonna ask a question. The question is, people ask, how do I get connected with ACLU? What is it? How do we get them to represent us? And it's a little bigger picture than just a lawyer. And so can you explain that for somebody to kind of see that?
So one of the many things I love about the ACLU is that we are not just a law firm. So I feel like in the past it had been that the ACLU, and there's a national organization and then there's affiliates, really focused on litigation. And that was what we did. And I think there's been just a very, I don't really know how recent it has been, but the thing that I love about the ACLU is that we have these other tools in our toolbox besides litigation. So we lobby in the legislature, we help senators draft bills, we testify in support, in opposition. And then I think one of the most important things that I think goes to your question, Jason, is we do know your rights, we do education, we are trying to empower people to better understand their rights. So there's a lot of ways to get involved, but but I appreciate that, because it's not just, you know, we might not be able to represent every individual that has a constitutional problem, because unfortunately there are so many people that do have constitutional issues. So while we can't litigate every single one of them, there are other opportunities to get involved. So no, I really appreciate you highlighting that, Jason.
Well, we definitely want to thank everybody here. If anybody that's comfortable with can give like a brief, if you have anything you want to say briefly, just in closing us out. And I think maybe we should just start in, just make it easier in the order of speakers. And so who spoke first?
I think I did. I did.
Okay. Oh.
I don't know. I think I'll just bring it back to one more thing about the Geneva situation that I think kind of ties in some of the broader things we're talking about. And that is that, just as this is an example where these are among the most vulnerable children in the state, and these are needs, they have significant needs that the state has said, we will meet these needs for you. But not only are they didn't provide them with treatment or care, they're actually traumatizing them and re-traumatizing them and making things worse for them. And I just think it really speaks to the problems with the system as a whole. But thank you. I really appreciate being included. So.
Was I next? I don't remember, but I do appreciate being asked to talk. I wish I would have been more prepared. I'm not exactly sure. So if anybody does have further questions or wants to know more, I would definitely be open to that as well. But thank you, Tessa and Nature, also for talking. Appreciate it.
Yeah, I just thank you guys for having us here and hearing us. I think one area that we could definitely start in is more education, you know, educating people on what their rights are within our systems, what their rights are working with DHHS, what their rights are within the mental health system. Like, there's just a lot of education. I myself am still pretty naive to a lot of it, but was definitely naive before getting into this type of work. And so just bringing awareness is half of it. Bringing education would be, I think, the next big step. So thank you, guys.
I want to plug that the Nebraska Department of Education is revamping their health standards, and our lovely governor is trying to completely take out all of the sexual health information, which completely erases sexual identity and gender identity from the health standards. It is a nightmare, and the way we protect our young folks from criminalization and harm and all the things is by supporting them and showing up for them and making sure that they're acknowledged as real human beings. So I'm dropping a link to the public input. If you would fill this out, it's really easy. These are the things that they are missing. And then here is the contact for your education board members. Please bother them. This is really important. Our young people deserve to see themselves in education and in standards. Thank you, Ashley. So I would love if everybody took, I mean, both of these take a good two minutes each even. So if you could do that, that would be amazing.
All right, I think I was next. So thank you all for letting me have the opportunity to kind of tell my story and speak on behalf of what I experienced and what I tried to do during my tenure at NDCS. Incarcerating someone and denying someone of their rights, their liberty, their privileges, that's one of the most consequential public policy decisions that government can make. And public policy and public administration is supposed to be a pluralistic process where everyone has a voice, all of our equities get considered, and everyone should have a seat at the table to give their input. So thank you guys for all of what you do, whether you're an activist or you're a mental health professional. No matter what you guys do, you guys play a part. And again, I can just tell you from having worked for NDCS, they don't always make the right decision. Sometimes they intentionally make the wrong decision. So your guys' involvement, your voice is more important than ever. And thank you again for letting me be here.
Yeah, I just want to thank everyone for sharing space again. And I really lost track of everything I was going to say. I'm so captivated by people that show up. I love how we're reminded that community really does have the power to do what we're doing, and that's look out for one another. And this is very heavy, frustrating work, but it's rewarding too when we come together like this and we're reminded of why we're here. So thank you all for everything you do. I can't stress enough how much every little moment counts. So yeah, just thank you for sharing space, and I'm gonna always do my part. And I love learning more so that I can not be so naive and be a part of that solution. So thank you to all out there that are tuning in as well and being a part of this move.
Well, thank you everyone, all of our excellent panelists for joining us, for making the event so informative and interesting. I'd actually like to extend a special thank you to Nature for really showing us the real impact of policies and action of a prison system that is just not working for anyone. It's not working for the people incarcerated, it's not working for staff, and it's not working for our state as a whole. And as I mentioned previously, nothing brings that home more than the real stories of real people. So thank you for that, Nature. I'm sure it wasn't easy to speak on that. So just to thank everyone as well for joining us, as Nature said, both via Zoom, and I know there's a few people watching on the Facebook stream as well. We'll follow up this event with any information the panelists wish to share, as Kenna just shared a link, and I'm sure there's other things that people want to direct the attendees' attention to, as well as a link to the recording of the panel, which will be shareable with anyone you want to share the event with who couldn't attend. So hopefully we'll see everybody at the next panel, which will be on sentencing reform on the 24th of August. And thank you again, everybody.